everyone, and welcome to our ADA event. So this is our agenda video. So in three, two, one.
America, America, make God thy gold refined till all success be nobleness and ever again divine. And you know, when I was in school, we used to sing it something like this. Listen here. Oh, beautiful, far spacious skies, far amber waves of grain, far purple mountain.
So the schedule of events is as follows. So welcome is by Marge Clemens, Chair ADA. Introduction by Dr. Timothy Miles, Program Manager. Speaker Quintana Stewart, MPA. Q&A by Lynn Shields, Secretary. So our next page of our flyer contains some COVID-19 requirements and some resources. And also our new office is located at the Disability Awareness Council, 2501 Homestead Road, Chapel Hill, NC. So thank you very much for coming, and we will have our welcome by Ms. Marge Clemens, Chair ADA.
Good afternoon, ladies and gentlemen. My name is Ms. Marge Clemens. I am the presiding chair for the Disability Awareness Council of Orange County. It is my pleasure to welcome everyone to our beautiful event this afternoon, Living Through COVID-19 and Having Disability. We are so excited to have all that is attending this. Thank you for coming. At this time, before our program begins, I would like to share a thought, a progress image with motivation shares about perpetuated strength. Measure not only the battlefields that one has crossed, but measure the mountaintops that one has proclaimed to climb. Therefore, unity must significantly be an impediment and impact among us together. Participating concerning the 3 W's, washing hands, waiting 6 feet away distance, wearing a safe mask. As I turned over MC the afternoon, thanks again for attending.
So now we will have our introduction by Dr. Timothy Miles, Program Manager.
Hello, everyone, and welcome again to Living Through COVID-19, a Vulnerable Population. The TDAC is celebrating the 30th ADA anniversary of the American with Disabilities Act. The Americans with Disabilities Act, better known as ADA, is the most comprehensive federal civil rights statute protecting the rights of people with disability. It affects access to employment, state and local government programs and services, access to places of public accommodation, such as businesses, transportation, and nonprofit service providers, as well as telecommunications. As many of us know, the ADA has 5 components. Number 1 is employment. Number 2 is state and local governments. Number 3 is public accommodations. Number 4 is telecommunications. And very important to us all is number 5, miscellaneous, which the key point is enforcement and who enforces those laws when they're violated. Honestly, this law to date is in practice as we speak. For example, the Department of Justice warns of inaccurate flyers and posting regarding the use of face masks and the American with Disabilities Act. So this is a new test for us in a pandemic. But I want you guys to know that some of the hot button topics that are circulating in the United States around ADA and COVID are face mask and the ADA. The ADA and face mask policies, face coverings and businesses balancing the ADA and public health during COVID-19. The ADA small business and face mask wearing. Face coverings in the ADA application of ADA Title III, which is public accommodations. Access granted building, a hospital experience, is another place where the ADA is being tested on all three areas: employment, public accommodations, and telecommunications. Even more important, the healthcare access, as I was mentioning, is an issue of accessibility at the drive-through medical sites. Healthcare and the ADA, all important to us all. Is critical time as we move through this pandemic. For these and other topics, you should go to the Southeastern ADA Technical Assistance Center website, which is posted in your flyer and your agenda that was sent to your email. Secondly, I want to say to you again, happy ADA, and thank you to the ADA Network of North Carolina, Ms. Karen Hamilton, who has supported us since 1991 through grants and ADA workshops that we put on with her throughout the state. If you need additional information, especially training on any of these topics, we can set up Zoom topics for any of these needs you may have. Just contact us at info@triangledac.org. Thank you so much and enjoy the program.
So now we will have our speaker, Quintana Stewart, MPA.
Good afternoon. Happy anniversary. 30 years is no small accomplishment. So kudos and congratulations. The work that you all do is so very important. And I have to say, in the midst of this coronavirus pandemic, the work that you do has been highlighted for me and my team on a daily basis. So I guess I'll start out this conversation this afternoon the way I'm starting most presentations or talks these days. I'll just share a little bit of data about what COVID-19 looks like for us here in Orange County. And then I'm going to talk through and just share some of the things that the health department and some of our other community partners are doing in response to the pandemic. And then I'll just turn it over back to you guys for question and answers, if that's okay. So as of today, in North Carolina, we have a total of 162,491 lab-confirmed COVID-19 cases. We've seen a total of 2,652 deaths. Here in Orange County, we now have 2,170 confirmed COVID-19 cases, and we now see 50 deaths total since this pandemic started back in March. The bulk of our cases right now, no surprise, excuse me. Right now, the bulk of our cases are being seen in the age group from age 18 to 24. They make up 45% of our cases as of today. So that's almost half of our COVID-19 cases right now in the county. Being a college town and with the reopening of university, again, that's it's not good news, but it's not a surprise to us either. Right now, you may hear in the media we talk a lot about the positivity rate, the percent positive. Our percent positive in North Carolina as a state is 6.9%. Here in Orange County, our percent positive has increased to 10.3%. So the percent positive really tells us, how the virus is moving and how the transmission is taking place in our community. Ideally, you would like for your percent positive rate to be 5% or lower. We had achieved that a couple of weeks ago, and now we've had this huge spike and we're now up to 10.3%. So that means out of all the tests that we've given in the county, about 10.3% of those tests are coming back with a positive result. Um, we currently have 3 outbreaks in our county. And so an outbreak would be 2 or more confirmed cases, and it shows that there is sustained transmission in one setting, one facility. So right now we have 3 nursing homes that are in outbreak status, 2 of our residential care facilities, and then we had 1 small outbreak in the county jail. Happy to report that we do have a strike team in place. And so the strike team consists of a nurse from the health department, a communicable disease nurse, community paramedics from our EMS department, and some other staff. We also have a firefighter that helps out with this group. But the strike team, they go out to all the long-term care facilities in our community. They do assessments, they offer training for staff. They talk to staff about, disinfecting, wiping down the facility, how to manage patients whenever you have a positive. So they do lots of cohorting. So if you have 1 or 2 positive patients, you want to put them like on the same hall, and you want to separate all your negative patients in an effort to slow the spread of the virus. So our strike team has been really busy since the beginning of this pandemic, and they continue to go out on a regular basis, again, to assess health facilities, train on proper use of personal protective equipment or PPE. So that would be their masks, their gowns, how often they should be changing their gloves, those types of things. So that has proven to be really beneficial and helpful, and I have really enjoyed the relationships that I've seen come out of this with our long-term care facilities that I know we probably would not have had otherwise. We have a very robust county website, and this is really like the hub of all of our information here in the county related to coronavirus. The website is orangecounty.nc.gov/2332/coronavirus dash COVID COVID/19. So our website, again, this is where you can go to find any and everything going on in the county related to coronavirus. We have several blocks and links up for many resources. One is a food resource tab. We have one for housing and utilities. We have one for mental health services. We have one for places of worship that are interested in now, coming back together to worship, but they want to do it safely. We have one for our businesses. It's just chock full of information and tons of resources. And I have to say, in all things that we do from the department, we are always trying to do it from our equity lens. We have been very active and heavily involved in doing equity work. So the department does not discriminate on the basis of age, race, color, disability, national origin, or sex. We are adamant about that. And so we allow equity to kind of drive all of our plans and activities that we do. And with this virus, this pandemic, again, it has really pushed us and made us stretch ourselves to think about how we offering our services. Are they equitable, and are they accessible to all? So some of the things that have come out of the pandemic as a result, and some changes for how we operate. Again, using our equity lens, we want to make sure things are accessible. So the goal is to remove those barriers. So one thing that's new for us as a result of the pandemic is our clinics. We now offer the telehealth appointments because we understand that, many folks are safer at home, and we also don't want folks coming out into the community, potentially been exposed to the virus if they don't have to. So we've now set up and we've started implementing telehealth appointments, so we can do it over the phone or via another device if you have that. So that's new for us. The other thing we've also started doing is we're trying to pick up on our testing, the COVID-19 testing. I was out at a testing site this morning. And so, we understand that drive-through testing is a good thing, and it makes it more accessible to many folks. But we also offer some walk-up testing if it's in a community where folks may not have a personal vehicle and they're not able to come out and use the drive-through model. And then just as of last week, we received additional resources from Department of Health and Human Services at the state for additional testing services. So at this time, if you all have an organization or you know of a place that needs some COVID-19 testing, reach out to us because we will be able to come out to you if folks aren't able to come out to some of the community testing sites that we have set up. Um, Other things that we do, thinking through equity, almost all of our information on that website, we translate into the 6 different languages that are spoken throughout the community. So we're mindful of that, and we try to make it accessible. And we don't want, language to be a barrier to getting the information. I have to say, when it comes to testing, another event related to testing, um, and if anybody on the call has had the experience of testing positive, or you have a family member or a loved one that has tested positive, you likely got a call from some of our staff as we do our contact tracing and investigation. And so the purpose of that is, again, we're trying to slow the spread as much as we can. So if we have someone that tests positive, we will call them to talk and try to figure out their movement, their whereabouts, and any close contacts that they've been around in the last couple of days prior to their testing. Again, the effort is to let people know and to have people quarantine, stay at home, or for those that may need testing, we want to work with them and make sure they can come in and get their tests. When we get this information, we gather it. It is private, absolutely, 100% private. We've had, especially with the return of students, some fear and folks concerned that they're going to get, a friend in trouble. But that is not the case at all. Again, our only goal is to reach out to the person, make sure that they understand that they were potentially exposed, and we want to get them services that they need so that they maintain their health. So we honor the privacy of all individuals, and we never share any of that information. And so that's something that I've heard a lot of folks talk about. During this pandemic, there's fear. Lots of our community members are afraid. This is a novel virus, it's new. To date, we still don't have a vaccine. So folks are afraid. So we get lots of pressure and lots of push to share this information about who is positive. But again, it's not something that we can do. It's against the law. We follow HIPAA standards. So we'll never share that information, but you will see we get lots of pushback and folks wanting us to identify, where people live that are positive. And that's something that we just can't do from the health department standpoint. I guess in thinking specifically about COVID-19 and how it may impact our community that may have some disabilities, I think a lot about the caregivers, household members. And what I would say is early on in this pandemic, we saw the bulk of our cases in the congregate facilities. And so what we realized is that in those congregate facilities, those community members weren't able to leave and go out into the community and then come back. So unfortunately, they were exposed most likely by staff, because staff work there, but they go home and they live their life. So a big takeaway was, it is so important for caregivers and healthcare workers to be mindful of pandemic precautions all the time, not just whenever they're at work, but also whenever they leave work and they're out in the community living their life. And so I would just encourage everyone to support household members and caregivers, to ensure that they have all the resources that they need so that they can maintain a healthy status and continue to care for those with the disabilities. I like the saying I heard earlier, you brought up the 3 W's. That is our mantra. That's something that we live by. So yes, we encourage folks to always wear the face covering, wait 6 feet apart from others whenever you're out in public, and then wash your hands often. That is one of the best things that you could do. If you can't get to sink with soap and water, the hand sanitizer works as well. So I encourage it. It works. We've seen it in this community. We saw our numbers go down, and we had like a 2.3% positive rate just a couple weeks ago. But it's because our community really pulled together, and we were doing the 3 Ws. This has been a challenge. It's been hard, not just on, it's no one particular sector of the population I feel that is suffering more than the other. I think this has been hard for our entire community overall. The business owners, many of them are still unable to open up, so that's their livelihood. The stress, if you have a small child, and now with school back on in session and it's online, that is a challenge, especially if you're also trying to work. And so I just want us all to be cognizant and try and take care of each other. That's what I would say, I guess, about this response for COVID-19. It's going to take the entire community, and we can't do it, just one by one alone. It takes the entire community for us to suppress this virus. I feel like I'm just doing all the talking, which is so different. Are there questions that I can take now, or?
Oh, there is a question in here. Brennan Booma says, what is the relative risk of airborne transmission versus on surfaces?
Hi, Brennan. Great question. And as much as I understand it, and I will admit I'm a little bit behind on some of my reading, but there's still some unknown about that. However, I will say that the science is pretty strong, and there's something to this airborne transmission because the masks work whenever we wear them. But I also believe it is important for us to wipe down and disinfect, frequently touched surfaces often, because you just think if you're at home, like now I'm in the office, but I'm the only person in my office, so I don't wear the mask when I'm in the office. However, before I leave, I'm still going to wipe down my workstation because I realize other staff may have to come in here and get something, and I don't want to have droplets or anything on these surfaces, and then they come behind me and they touch it. So it is still just as important to wipe down and disinfect the frequently touched surfaces, as well as wearing your mask to prevent some of the droplets and maybe some airborne transmission, if that in fact is valid.
I would like to ask a question. What type of mask do you think is strong to use?
So the ones that if you're working in a healthcare setting and you're doing any type of procedure and there's some type of aerosolization that could happen as a result of that, then we really encourage you to wear a N95 respirator. And those are the ones you have to be fit tested for, and they ensure that you can't smell and taste things, and so it's a very secure fitting. For average community members out day to day, and this is what I'm wearing, but I have a cloth face covering that I wear. I have several actually, get through the week until I do laundry. But you want a fabric that's not too loose. You want to be able to breathe, but you want one that has a pretty good thread count. But these are also, they're just as effective for going out to the store and then coming back home, not doing any kind of healthcare or medical procedure. They also have the surgical masks, and they're back in good supply and stock now. You can find them out at all the drugstores and at Walmart. And I also have some of those that I will wear, but they too also work, the surgical masks.
Thank you.
Mm-hmm.
I actually have a question of my own.
Mm-hmm.
What is, so we talked about the test positivity rate. How do they calculate something closer to what the actual positivity rate out in the general population is? Because I've heard that, or I guess that the test positivity rate would be higher than that because people are more likely to get a test if they feel sick.
That is correct. And as we've learned over the last month or so, we have a high number of asymptomatic folks walking around, so they have no symptoms, and so there's nothing that would trigger them to go take a test. And so I agree that I believe our percent positivity rate probably is actually higher than what we're calculating, but all we have right now is we can only take the calculation based on the number of tests that we've conducted. So during some of these recent community testing events that we are having, you may hear the company StarMed. That's the vendor that was assigned to us here in Orange County. They are actually testing anyone. So they're going to capture those with symptoms and the asymptomatic folks. It still won't get us to a exact number to tell us what the positivity rate of our entire community is, but allowing asymptomatic folks to be tested, that will get us a little closer. If you've been following the news, you probably heard that CDC recently changed some of their recommendations around testing, and they said, well, if you are asymptomatic, you have no symptoms, even if you were a close contact to a positive case, we're not recommending strongly that you get tested. You can if you want to, but that's no longer our recommendation. Well, that's what CDC said, but I will tell you that North Carolina, our Department of Health and Human Services, state public health, and here in Orange County, local public health, we are not shifting to follow that recommendation at this time. We will continue to test folks that are asymptomatic if they were indeed listed as a close contact to a positive case. And at the community-wide testing events that we're currently doing, we also will test symptomatic and asymptomatic folks as they come up.
So now we will have a Q&A by Ms. Lynn Shield, Secretary.
Okay, did you want me to go on to the next part?
Are there questions you had from people? Did you put them in the queue or tell us?
Just two that were submitted ahead of time for the question period. I can do that now if you'd like me to.
Yes, please.
Okay, what is the capacity of a shelter under the new guidelines for that were changed due to the coronavirus? And I'm sure Quintana knows this. Does anybody else know? Okay, Quintana, would you like to answer it or would you like me to answer it?
Well, you can answer if you would like.
Okay, and by the way, my name's Lynn Shields. From what I have read and talked to an American Red Cross employee, the current capacity for shelters under the new guidelines are 50 individuals. And health screening questions and temperature checks will be taken upon admittance to the shelter. And if anyone is in question, they will be isolated. And if you have any more to add to that, Quintana, that's fine.
Thank you. You are absolutely correct. And I will just add that here in Orange County, actually some of our plans include maybe not going into the traditional shelter setting, but using local hotels so that we can keep folks separated and decongregated, I guess that's the word. So yes, that's what we actually are doing in the process with our homeless shelters, because we don't want to have folks congregated in one setting. So we have some funding from the state that supports our ability to house folks temporarily in the hotel setting. And so if we have to, fingers crossed, we won't have to open up shelters in response to all these hurricanes, but I know that would be the first choice.
How would they handle food at the shelter?
So they set up a feeding plan the same way we would if we were in the schools. So social services and some of our other community partners work together to ensure that we serve and provide the meals to folks.
So we would not have to bring anything?
No, if you had to go into a shelter?
Yeah, as far as food.
Correct.
And what about the medications?
if you can grab your medications, we ask you to bring your medications. If it is, an emergency and you can't get it, then we do have nurses on staff that will work with you and assist in getting medications that you need.
Excellent.
Quintana, under the new guidelines, are there any additional items that we would be required to the shelter that we would not have to bring under normal circumstances?
No, nothing,
Okay.
nothing else new or changes.
Okay, thank you.
Last question for me, and I'm not trying to wear you out.
No, you're fine.
You've done such an excellent job. In terms of written or other kinds of instructions, how would you guys handle that? Would it be, if you know of people who have blind or visually impaired or other issues, how would you handle the accommodations piece? Have they talked about that?
Yeah, so currently what we have, many of the county departments, we have outside contracted services. And so I'm drawing a blank on the name of the company. It's not telelanguage, but we do have a company that we work with that helps us with the interpretation of items. And then we have devices on hand that will help if we need like magnifiers to make reading easy for those that are vision impaired.
And can I, when you go back to them, just recommend to them that where they can provide large print, that would be helpful if you're giving out printed information.
Gotcha. We'll add that to our toolkit because we try to have as many of these things, printed out ahead of time. So thank you for that.
Oh, you're welcome. And also I was thinking too, in some cases, if we're on the special needs registry, if that still exists, if they have things they can go ahead and send to us prior to, like, let's say a tornado that you want us to know going to the shelter, we could get it through email too.
Okay. So, I can talk to my communications manager because she's a wealth of information and we have many of our emergency response kind of communications already canned. So I just need to make sure I can get her to this Dr. Timothy Miles I'm speaking with?
Yes, you're talking to, yes.
Okay. And I will say one thing I did not say to Lynn's question. So if you have to present in the shelter, be sure and bring your mask. Have your mask.
Right.
Crotana, this is Ms. Marge Clemens. What do they do about sterilized when you do they indicate about wearing gloves, or what do they do within that? How link are the beds away from each other?
Yeah. So it will be a different kind of setting, which is why the number has been reduced. So they will have to physically distance all the cots and the beds and things in the shelters. So we maintain at that minimum of 6 feet. They'll probably try to do a little more, realizing folks may have personal items around as well. As far as the gloves, I don't know that gloves will be recommended, but a frequent cleaning schedule of the wipe down, disinfecting, I know that will be implemented and take place.
Another question, how would they deal with someone that's in a wheelchair?
In the shelter, how would they deal?
How would they deal with someone that's in a wheelchair? How would they provide the assistance that is needed for them?
Yeah. And so to me, I think we do the same thing. I had an opportunity to work in a shelter with our last storm. Was it last year, maybe? I'm sure it was last year. I worked one of the shelters for the public health shift. And so the cots and the accommodations they had, this shelter was at DSS for this particular event. And we did have someone that was in a wheelchair. So we assisted the person whenever they were ready to get on the bed for sleeping, but their cot was located like at the end of a row, so they had more space to maneuver and get around. Everything in the department was already ADA compliant, so the tables and everything else when roll up to, they were in compliance. Coming into the door, it had the manual, the operated door, the electric door they could push and use. So our facilities are ADA compliant that are used for these shelters. And then you have staff there to assist.
Okay, thank you.
Mhm.
Oh, there is a question from Christina Bauman that says, will you provide cots at the shelter?
So we work with Red Cross, my understanding. And I don't know if anybody else is on here that has all the details. I don't know all the details of those logistics, but there are beds and cots available at shelters that we set up. Yes.
As far as you know, this is Dr. Miles again.
Mhm.
Families would stay together.
Yes.
And my last question, Orange County's plan, is it representative of a big plan for the state that has like a master and then you divide according to your own region? Does that make sense?
Yeah, I understand what you're saying. So yes, each county is required to have certain elements in their response plans, and that we have to follow a template, you know, kind of from the state. Yeah, and so there is an overall master plan from the state, and then yes, you have to tailor it based on your needs and resources in your respective county.
Okay, Dr. Miles, are you ready for the second submitted question?
Yeah. Oh, my question would be, what about transportation to the hotels, Quintana, or the shelter? How would disabled people get there?
So if we follow some of the planning models that we've used in the past, OCPT, Orange County Public Transit, they were partners and they assisted us with transporting everyone to shelters and hotels as needed.
And this would be for the Chapel Hill, Carborough, Orange County area, or would you use local transit?
In Chapel Hill, they also were our partners in the Chapel Hill area. Yeah. Forgive me. I live in Hillsborough. I live towards that county side. But yes, Chapel Hill, they were partners and they assisted as well.
Okay.
So Nisha Johnson says 50% question mark. I'm not sure what that refers to.
I think she was answering about the shelter capacity.
Oh, okay. I was wondering, was that way back from like from the test positivity rate?
No, she was asking about the capacity that Lynn talked about, and she was confirming that it's 50%. Is that right, Lynn?
It isn't 50%. It's a maximum of 50 people.
50 people.
Yes.
In a space.
In a shelter, yes.
She says, thank you.
And then just a kind of a follow-up on the last question you just asked, Dr. Miles. The second submitted question was, in the event of a mandated evacuation, is transportation, does it need to be provided under the ADA? And we pretty much touched on that. And the answer was, and Quintana, you can also add to this, yes, they are required to, but they can only take you to the shelter. And I'm sure under these circumstances, the hotels would be added, but just to differentiate, they can't take you like to a friend's house or a family member's house.
Yeah.
Can they take you to the grocery store, to the, what do you call it? Quick Pick on the way?
I don't think so.
No, I'm pretty sure that's a no.
That's a no.
Yeah.
Quintana, you guys, I'm trying to tell you some of the stuff that comes up in transportation. They're like a lot of side trips.
I understand.
All right, now for the fun part. We will have 6 door prizes. The winner must be present to win the prize. And the prize will be shipped to each individual winner. Congratulations to the first winner, and it is Rhonda Suggs. That's Rhonda Suggs. Are you with us, Rhonda? Can the host tell if Rhonda is signed in?
There is a response in chat that says she is here.
Okay, good. Thank you. Congratulations. Okay, on to winner number 2. And we are going to draw this one from the bottom of the bag, and it's going to Alma Rodriguez. Alma, are you here? Anything coming through chat that shows that Alma is here?
No, not yet.
Okay, do you know if she signed in today?
I'll check.
Okay, we will go on to winner number 3.
Oh, somebody says yes on Patricia Whitley's computer, so I don't. That could have been a few minutes ago, but
That was for Rhonda Suggs.
okay.
Okay, we'll go on to winner number 3, and congratulations is in order for Vanessa Lacer. Is Vanessa here?
Yes, I'm here.
Well, congratulations. Good to hear a voice, and thanks for attending.
Thank you so much. Woo! Yeah!
All right, who will lucky number winner 4 be? And we're going to go to the left side of the bag this time. Did y'all hear the bag moving? I don't think you do you? Huh? And congratulations are in order for a gentleman who does so much for people with disabilities, and that is Ronnie Marshall, owner of Special Treats. Are you here, Ronnie? Nothing, anything coming through on the chat from Ronnie?
No, I don't see anything. Also, Elma Rodriguez was not there in the participants list. Although she might be on a phone, but I don't know.
Okay. Okay, the next to the last winner, and that will be drawn from the middle of the bag. And congratulations go to Karina Garris. Are you here, Karina? Anything coming through on chat?
I think Karina signed in earlier.
Okay, well, we we will have to check on these and we'll just go on to the last and final winner at this time. And last but certainly not least is Stephanie Bryant. Are you here, Stephanie?
Nothing in chat.
Dr. Miles, should we draw any more or just leave it as is until these are checked on?
You could draw 2 more if you want.
All right, so we will draw 2 more winners. And this one is going to be taken from the right side of the bag that you don't hear. The next winner would be Latasha Alexander. Latasha, are you here?
I'm here.
Oh, congratulations. Thank you.
Thank you.
Nice to get a response. Enjoy your prize. I don't know what it is, but you'll be surprised. And the final winner is going to be taken from the very bottom of the bag, and his name is Jeff Butterworth. That's Jeff Butterworth. Are you here? Anything coming through on chat?
No.
Okay, well, I think that completes the drawing for the door prizes.
Again, thank you so much, ladies and gentlemen. I would like to close out by saying to our guest speaker, Quincy Stewart, MPA Health Director of Orange County Government. Your presentation was phenomenal, unique, and very informative. Thanks for accepting our invite as a guest speaker. We really enjoyed you. Also at this time, I would like to graciously thank our Honorable Chapel Hill Mayor Pro Tem Michael Parker. Are you there? I haven't heard anything from you as yet, also our City Council, Alan Bonas, Susan McLean, Director of Development and Communication, Disability Rights, North Carolina, Philip Woodward, Assistant Change Management Manager at North Carolina Council on Development Disability, also our interpreter, David Payne and Kristen Copley, plus the Disability Awareness Councils and our board directors and our volunteers, Albie, Vershaw, Daniel, Walton, for their continual extraordinary volunteering, certitude service. By the way, we are open for new memberships on our council and board. Please don't hesitate if you are interested in joining us by visiting our website at www.triangleledac.org. That's TRANGLEDAC.org. Thanks again to all our guests that joined us throughout the area. We really appreciate it of your time attending our event. Have a wonderful weekend. Thanks again for attending our 30-year anniversary of ADA. Appreciate it.